Hello, everyone. This is my PhD title, The Role of Inflammation in the Progression of Abnormal Glucose Tolerance. My name is Huang. I'm from Shenzhen City, China. I'm a nurse and I worked at the hospital for 4 years. For me, this is a great opportunity to study here, and I really love and enjoy this journey. Here is my team. My vision is global access to education and resources to prevent prediabetes from progressing to type 2 diabetes. My mission is to determine which factors affect the progression of prediabetes into diabetes. Here are my specific goals. Both of them are systematic review and meta-analysis. The first project title is Investigating the Effects of Inflammatory Mediators on the Development of Diabetes in Adults with Prediabetes. Why we need to care so much about prediabetes? Because prediabetes is rising globally, with 5 to 10% progressing to diabetes annually. Over 470 million people will have prediabetes by 2030. Obesity, dyslipidemia, and hypertension and inflammation are key risk factors for prediabetes. Especially, inflammation fuels these risk factors and is central to the development of prediabetes. Although inflammation is well recognized, there is limited literature summarizing the effects of inflammation on prediabetes and its progression in adults. So, my aim is to explore how various inflammatory mediators influence the progression from prediabetes to type 2 diabetes. The clinical question is, do inflammatory mediators modify the risk of developing diabetes in prediabetic adults? The population is adults with prediabetes. The exposure or comparator is levels of inflammatory markers. The outcome is development of diabetes. The hypothesis is elevated levels of inflammatory markers are associated with an increased risk of developing diabetes in adults with prediabetes. The clinical implication is anti-inflammatory drugs could be used to prevent disease progression and identify high-risk populations. The search key was divided into 3 domains. The first one is prediabetes. The second one is inflammatory mediators. And the last one is prediabetes progression or reversion. Here, we present the package of 4 key articles. The population is prediabetes. The exposure or comparator is different levels of hsCRP. The outcome is progression of prediabetes to diabetes or reversion to normal glucose levels. After duplicate removal, there are 36,000 articles remained. And now, we are doing the title and abstract screening, and this is my first project's progress. For my second project, the title is Investigating the Effects of Inflammatory Mediator Levels on Disease Progression and Comorbidities in Patients with Metabolic-Associated Steatotic Liver Disease. Let's talk about MASLD. It affects about 30% of adults worldwide, especially those with obesity 80% and type 2 diabetes 22.5%. What's more concerning is the rising incidence. It increased nearly 60% from 1994 to 2014 and reaching about 5% in 2019. The chronic low-grade inflammation plays a key role in MASLD, linked to obesity, insulin resistance, and metabolic disorders. Biomarkers such as hsCRP are valuable for assessing disease severity and identify high-risk population. So our focus is to understand how inflammation and obesity influence disease progression and comorbidities. The clinical question is, do the level inflammatory mediators correlate with the disease progression and comorbidities in MASLD? The population is MASLD or MASLD or NAFLD. The exposure is obesity. The comparator is non-obesity. The modification is inflammatory mediators. The outcome is progression to comorbidities. Our hypothesis is inflammatory mediators may contribute to the progression to comorbidities. The clinical implication is targeting obesity-driven inflammatory pathways in patients with MASLD may offer to therapeutic strategy to slow disease progression and reduce the risk of comorbidities. The preliminary search key also divided into 3 domains. The first one is NAFLD, MASLD or MASLD. The domain 2 is inflammatory mediators. The domain 3 is about progression of comorbidities. Here, we also present the package of 5 key articles. The population is about patients with NAFLD. The exposure is obesity. The comparator is non-obesity. The first outcome is levels of inflammatory mediators. The second outcome is disease progression and associated comorbidities. Finally, I will give an overview of these projects. Both focus on the role of inflammatory mediators in metabolic disease, particularly in the progression from prediabetes to diabetes and comorbidities related to MASLD. As I wrap up, I'd like to leave you with a thought from Gary Player, who once said, "The more I practice, the luckier I get." Thank you for your attention.
Thank you so much for your nice presentation. And if I well understood, in your first project, you excluded pregnant women and also the youth, so the young generation. Why did you do that?
Thank you for your question. Because the pregnant women, children, and adolescents have different disease mechanism and metabolic characteristic. And so in our study, we just focus on the type 2 diabetes in common adults. And in addition, the treatments and drugs in practical practice is different from this special population is different from the common adults. So we exclude them and make sure our results interpretability and reduce the heterogeneity. Thank you.
I have one question, if it's possible. What do you think, what are the most important inflammatory mediators in this disease?
Thank you. In our study, we found many researchers use HSCRP in their studies. Maybe it's cheap and convenient in clinical practice, but if we found other inflammatory mediators in other studies, we will do the subgroup analysis. Thank you.
Okay, thank you.
Could you please clarify particularly which subgroups are you going to work on in order to understand which kind of specific inflammatory markers for diabetes to reach this specific answer for this? Thank you.
Can you speak more slowly?
So which subgroups particularly to be much more specific, so to understand these inflammatory markers regarding this previous question that asked.
So what subgroups are you going to try to make?
Yes, in our study, there is one subgroup study, one subgroup. And thank you. I'll try my best to answer your question. Sorry.
Sorry, do you mean which inflammatory factor might be the most important one, or?
Yes.
Yes. Okay. So, what do you think? What of these factors might be the most important one? What is the most influential one? Which inflammatory factor?
Most important factor. In the literature review, we found insulin resistance and obesity and inflammation also very important. If we focus on the inflammatory mediators, because most of the studies uses the HSCRP, and very rare studies use the such as IL-6 and this. So I can't now I can't determine which factors is the most important.
Okay.
So, thank you.
So this is the reason why you are doing this study.
Thank you.
Thank you. Thank you. Excellent.